Hello everyone. With this diagram, we'll try to learn how blood pressure is regulated. It is done by three regulatory mechanisms, that is short-term regulatory mechanism, intermediate regulatory mechanism, and long-term regulatory mechanism. Short-term, it takes usually seconds to minutes, whereas intermediate takes the duration would be in minutes to hours, whereas long-term, it takes hours to day to compensate. In short-term mechanisms, we have baroreceptor mechanism, chemoreceptor mechanism, and Cushing's reflex. Baroreceptor is nothing but whenever the blood pressure increases, it is going to stimulate the baroreceptors in the sinuses. That is going to inhibit the vasomotor center and stimulate the cardiac inhibitory centers that brings back the blood pressure to the normal. Whereas chemoreceptor mechanism occurs whenever there is alteration in the H plus ions, decrease in the partial pressure of oxygen or increase carbon dioxide. It is going to not only stimulate the respiratory center but also cardiovascular regulatory centers to increase the heart rate and the blood pressure. Whereas Cushing's reflex occurs whenever blood pressure reduces less than 30 mm of He, severe hypotension, which causes directly hypoxia to the vasomotor center that increases the blood pressure. Whereas intermediate mechanism are stress relaxation of the vascular and body fluid shift mechanisms. In stress relaxation of the vasculature occurs whenever blood pressure increases for longer duration. The smooth muscles of the vessel, they adapt to the different length that they relaxes, and there will be pooling of the blood occurs that decreases the blood pressure. Whereas body fluid shift mechanism occurs again because in case of increased blood pressure, where capillary pressure increases, the fluid starts moving from the capillary into the interstitium that decreases the blood pressure. Whereas long-term mechanisms include renin-angiotensin mechanism and renal body fluid shift mechanism. In renin-angiotensin mechanism, it occurs, activation occurs mainly during hypotension, which causes the stimulation of macula densa. Macula densa stimulates production of renin from the JJ cell that increases the angiotensin 2, and angiotensin, it is going to increase the blood pressure. Whereas renal body fluid shift mechanism occurs in case of hypertension, where increase in the pressure causes increased ultrafiltration of the sodium and water causes natriuresis and diuresis, thus brings the blood pressure back to the normal.